Hello everyone, welcome to this lecture series. My name is Dr. Omi and I'm going to take you through the anatomy of the larynx, the gross anatomy of the larynx. So, the larynx is a portion of the respiratory tract that contains the vocal cords. It's a portion of respiratory tract that contains the vocal cords and it's 2-inch long. It's tube-shaped and usually opens into the laryngeal part of the pharynx. Remember we said it opens into the laryngopharynx. So this portion is the laryngopharynx, just below the epiglottis, that's the laryngopharynx, communicating with the larynx, and the larynx is tube-like. It houses the vocal cords and extends down up to the lower border of cricoid cartilage where it continues as the trachea. So it continues to the trachea below and it subserves 3 major functions. The larynx has a role in swallowing, a role in respiration by carrying the air from the pharynx into the larynx and into the trachea. And because it contains the vocal cords, it has a role in phonation, voice production. So what are the relations of the larynx? Now, we have lateral to the larynx. This is the larynx. The larynx is made up of cartilages. So lateral to the larynx, you have the carotid sheath. The carotid sheath usually contains 3 major structures: carotid artery here, internal jugular vein, and in between there's the vagus nerve. So those are the 3 major branches, 3 major components of the carotid sheath, and they lie lateral to the larynx. Then superior and inferior thyroid arteries are also closely related to the larynx. Superior and inferior thyroid arteries, as they're coming to supply the thyroid artery. So superior thyroid will come this way from the external carotid artery, and inferior thyroid comes upwards from the inferior thyroid is from the thyrocervical trunk, which is from the second part. The thyrocervical trunk, which is from the first part of subclavian artery. So superior thyroid from external carotid coming to supply the thyroid superiorly, and inferior thyroid artery from the thyrocervical trunk, which is from the first part of subclavian artery. Then we also have superior and recurrent laryngeal nerves. So as you can see here, there is a recurrent laryngeal nerve, okay, and we also have superior laryngeal nerve by the side of the larynx. So these are the important structures you need to know that are around the larynx. The carotid sheath content, that's the common carotid artery with its branches, that's external and internal carotid artery. Then you have the jugular vein and vagus nerve. Then you also have superior and inferior thyroid arteries, as well as superior and recurrent laryngeal nerves. So what's the structure of the larynx? It's mainly made up of cartilage, okay? It has a cartilaginous skeleton, but we also have membranes and ligaments, intrinsic and extrinsic muscles, as well as mucosal lining. So you have those 4 components: cartilage, membranes and ligaments, intrinsic and extrinsic muscles, and mucosal lining. So as you can see here, you're able to appreciate the thyrocartilage, you can appreciate the cricoid cartilage, but we also have muscles such as cricothyroid muscle and cricothyroid ligament here, and there's a thyrohyoid membrane that joins the thyroid cartilage to the hyoid bone. So this is the skeleton of the larynx from anterior aspect, and you can see it continues inferiorly as a trachea. What are the cartilages of the larynx? So we have single cartilages that are centrally placed and paired cartilages that exist on the right and the left. So single cartilages we have such as thyroid cartilage and cricoid cartilages. These are made up of hyaline cartilage, and we also have the epiglottis. Epiglottis is made up of elastic cartilage. Then we have paired cartilages such as arytenoid. As you can see here, that's arytenoid cartilage. We also have cuniculate and cuneiform cartilages. These are made up of elastic cartilage. So you have thyroid, cricoid, epiglottis, arytenoid, cuneiform, cuniculate, all those are cartilages of the larynx. This image shows you the epiglottis here. This is on the posterior aspect, what you're able to appreciate. This is the epiglottis. Then you have muscles such as aryepiglottic muscle, okay? Then you have oblique arytenoid muscle, cuniculate tubercle, cuneiform, tubercle. So you have cuneiform, corniculate, okay? This is epiglottic and ariepiglottic fold, a fold of mucosa over the epiglottis. And then you have posterior cricoarytenoid muscle, the transverse, it's running transversely, transverse arytenoid muscles, okay? And then you have your cricoid cartilage here. This is thyroid cartilage. So basically, this is how the larynx looks like from the posterior aspect. So all cartilages of the larynx, except epiglottis, are made up of hyaline. The epiglottis is mainly elastic cartilage. The cartilages are connected by joints and membranes as well as ligaments. The cartilages are connected by joints, and then you also have membranes such as hyoid and thyroid are connected by thyrohyoid membrane. Okay, then we have ligaments such as cricothyroid between cricoid and thyroid. This is cricoid, this is thyroid cartilage, so cricothyroid ligament. And these cartilages are of the larynx are moved by muscles. So like here we have your cricothyroid muscle anteriorly, and we've seen some muscles posteriorly, such as posterior cricoarytenoid, we've seen the oblique arytenoid, and so on and so forth. So the epiglottis is leaf-shaped and it's found behind the root of the tongue. It's leaf-shaped and found behind the root of the tongue, and it's connected in front to the body of the hyoid bone. Okay, connected in front to the body of the hyoid. This is the body of hyoid by the hyoepiglottic ligament. By its stalk, it's connected by its stalk to the back of the thyroid cartilage. Okay, by the thyroepiglottic ligament. So to the hyoid by hyoepiglottic ligament, and to the thyroid cartilage by thyroepiglottic ligament. So that's a leaf-like epiglottis, which is made up of elastic cartilage. The upper edge of the epiglottis is usually free, and laterally the epiglottis gives attachment for ariepiglottic fold. Epiglottis on the lateral aspect will give attachment for the ariepiglottic fold. So the anteriorly, the mucosa of the epiglottis is actually reflected onto the tongue, forming the glossoepiglottic fold. Okay, so this is the glossoepiglottic fold, and then you have the vallecula beside it. So anteriorly, the mucosa of the epiglottis is reflected onto the tongue, therefore you form the median glossoepiglottic fold and the vallecula. Then we discuss the laryngeal cavity. Laryngeal cavity extends from the laryngeal inlet to the lower border of cricoid cartilage. So from the laryngeal inlet to lower border of cricoid cartilage, because below lower border of cricoid cartilage, that's the trachea. So the laryngeal cartilage is narrow in the region where you have the vestibular fold. It's narrow where you have the vestibular fold, and that's where we call the rima vestibuli. Okay. So the laryngeal cavity is narrow in the region where you have the vestibular folds. These are the vestibular folds, and the portion of the vocal cords. You can see the vocalis muscle. So this is the portion of the vocal cords. That's this narrow portion of the larynx. We call it the rima glottis, folds. So you can appreciate the false vocal cords bilaterally, and vocal cords are here. So at the false vocal cords, you have your rima vestibuli, and at the true vocal cords, the space of the larynx, the cavity, is where we have the rima glottidis, and that's the cricoid cartilage, and below the cricoid cartilage is the trachea. So the laryngeal cavity. The laryngeal cavity is divided into three parts. So we have the supraglottic part, which is above the vestibule. Okay, as shown here, A, supraglottic part above the vestibular fold. So this is the vestibular fold. Then a portion between vestibular fold and vocal cords. Between vestibular fold and vocal fold, that's what you call the ventricle. Then below the vocal folds is the infraglottic part, vestibular ventricle between vestibular and vocal fold, and infraglottic compartment cords. And you can appreciate that's the epiglottis, the epiglottic ligament connecting the epiglottis to the hyoid bone. Then there's the thyroid ligament connecting the epiglottis to the thyroid cartilage. This is the thyroid cartilage, and this is the cricoid cartilage. And there's that part, the pre-epiglottic space that contains there, and the ariepiglottic fold of the epiglottis, and this mucosa on the anterior surface of the epiglottis, it carves the base of the tongue, and that invagination of the mucosal fold from the anterior aspect of the epiglottis to the tongue, it forms a potential space which we call the vallecula. Remember, we have fossa, that's the posterior part of the. So you have the piriform fossa, that's the posterior part of the laryngopharynx going on both sides of the larynx. So supraglottic part, the ventricle, and the infraglottic part, and all these are separated by the vestibular fold and the vocal fold. So the mucous membrane of the larynx is lined by ciliated columnar epithelium. It's a respiratory epithelium, and we have the vocal folds, which, because they're exposed to continuous trauma during phonation, as you produce voice, there is continuous trauma. So the vocal cords are actually lined by stratified squamous epithelium. So the larynx is lined by ciliated columnar epithelium, but the vocal folds have stratified squamous epithelium because of continuous trauma during phonation. Now, there is the presence of mucus glands in the mucous membrane of the larynx, and this obviously they produce mucus that helps to lubricate the vocal cords as they move during phonation. We have muscles of the larynx. They're divided into two, extrinsic and intrinsic. The extrinsic muscles of the larynx are further divided into two. You have those that elevate the larynx and those that depress the larynx. So extrinsic muscles are divided into elevators and depressors of the larynx. Then we have intrinsic muscles of the larynx, which are also divided into two. You have muscles that control the laryngeal inlet and those that control the movement of vocal cords. Muscles controlling laryngeal inlet and those that control movement of the vocal cords. So muscles of the larynx, extrinsic that elevate and depress the larynx, and intrinsic that control the laryngeal inlet and the movement of the vocal cords. So the elevators of the pharynx. Which are these elevators of the pharynx? We have suprahyoid muscles, muscles above the hyoid. So you have the digastric muscle, this is the digastric muscle. You have stylohyoid from the styloid process to the hyoid bone. Okay, this is the hyoid bone. So digastric is from the mandible, but it usually held onto the hyoid bone there by an intermediate tendon. Then we have stylohyoid. There is the mylohyoid. This is the mylohyoid muscle. Then there is geniohyoid muscle from the genu of the mandible to the hyoid bone. Okay, so those are the suprahyoid muscles. They elevate the larynx. Digastric, stylohyoid, mylohyoid, digastric, and geniohyoid. Then we have longitudinal muscles of the pharynx. These also help to elevate the larynx. These include stylopharyngeus from the styloid process to the pharynx, the salpingopharyngeus, and the palatopharyngeus. Then we go to the depressors of the pharynx. Which muscles depress the pharynx? Mainly the infrahyoid muscles, muscles that are below the hyoid bone. This is the hyoid bone. So these include the sternohyoid from sternum to the hyoid, sternothyroid from the sternum to the thyroid cartilage, and the omohyoid muscles. So the pharynx, the elevators of the pharynx include suprahyoid muscles and longitudinal muscles of the pharynx, while depressors of the pharynx include infrahyoid muscles. So this portion explains the movement of the muscles that cause movement of the pharynx now and the larynx, because they are attaching onto the thyroid cartilage. So we have muscles that control the laryngeal inlet. You have the oblique arytenoid. Okay, oblique arytenoid, it's running obliquely, and you have the aryepiglottic muscle. The aryepiglottic muscle. So oblique arytenoid and aryepiglottic. So when these contract, you sort of reduce the laryngeal inlet diameter. Then you have muscles that will increase the length and the tension of the vocal cords. And the main one is the cricothyroid muscle. So this is the cricothyroid, from the cricoid cartilage to the thyroid cartilage, cricothyroid muscle, as you can see here. So what happens? Cricothyroid increases the distance between angle of thyroid cartilage and the vocal processes of arytenoid cartilage. So cricothyroid increases the distance